Hi, my name is Adam Peetz, and I've been a physical therapist here at City Regional Medical Center for the last 8 years. Over this last year, we've gone through a lot of changes due to COVID and the pandemic. Over the last year and a half, we saw a large decline in the amount of patients that we saw initially due to just PPE restrictions and for patient and care providers. We also were kind of exposed to a new area of physical therapy, of treating patients post-COVID, and while they were having COVID, where we had to put on PPE, go into the rooms, and help them get moving better so they could get moving and grooving back sooner. One of the other things that we learned through the pandemic from a physical therapy standpoint is how to effectively treat patients, both by limiting exposures to ourselves, to other patients, use of protective equipment, and support with staff. Being in a small rural area, the amount of respiratory patients that we saw before were relatively small. After COVID, that's become much more common, and we're actually seeing patients now post-COVID who are still having symptoms even months after having the disease resolved. Again, this kind of makes us put our thinking caps on, trying to find different ways to treat patients that before were healthy, where we're treating patients that are very limited on how much aerobic ability they have. One of the benefits of being in a rural area was that we were able to open up sooner than most larger urban areas, where we never had to close and we were able to provide patient care on a continuous basis. We learned very many things from COVID. Most important in our realm is, number one, how to treat patients when they're not actually in front of us. And across the nation, physical therapists have been using now virtual platforms to provide care, able to help patients on a much larger platform than what we were before.